Our first speaker is Francois Martin from Nestlé Purina.
I'm very happy to be here today, and I will be talking to you about a collaboration between Nestlé Purina and the Mayo Clinic. I don't know if you're not from the United States. The Mayo Clinic is a very famous hospital in the United States, and Nestlé and the Mayo Clinic decided to work together on a research project, and I will be talking to you about this project. So we ask ourselves two questions. The first one is, would interacting with a dog would improve the emotional state of people with fibromyalgia during their participation in a treatment program at the Mayo Clinic? And the second question we asked ourselves was, does participating in AAA impact the emotional state of therapy dogs? We're still analyzing the data for the first question, so my talk will focus on the dog data. So despite the popularity of AAA, little is known regarding the effect of these interactions on the animals involved. Our objective was to assess the welfare state of therapy dogs during interaction sessions using non-invasive physiological indicators of emotional state. So therapy animals are regularly put in situations that are unusual and potentially stressful. For example, they encounter unfamiliar environment, people they don't know, smell they're not familiar with. It could be different stimuli that they're not familiar with. A wheelchair, a bunch of people wearing white coats in the hospital. It could be hot in the room, or it could be inappropriate or challenging behavior from the human they interact with. For example, a patient may become overly excited and may act in a way that could be perceived as being potentially threatening for the dog. And there's also the fact that the dogs very often don't have the possibility to retreat from a situation that they may not feel comfortable with. So if you take all of this together, it's a fair question. Is animal-assisted therapy potentially impacting the well-being, negatively impacting the well-being of the dogs involved? So there's not a ton of literature on the subject, but there are a few good papers, and we will look at a few of them. So the first paper was that I will talk to you about was published in 2018, and the author measured the cortisol and behavior in therapy dogs participating in sessions with children with cancer and their parents. They found minimal signs of distress during the sessions, and there was no correlations in cortisol level between the sessions and the baseline levels. Clark and colleagues compared canine salivary cortisol levels pre and post sessions, and dogs had lower cortisol levels when they perform AAA twice a week compared to once a week, once every other week, or once a month. So it doesn't look like participating in irregular sessions was impacting them. On the contrary, it looks like they were doing better as far as cortisol. So in 2017, Glank provided, I asked her how to pronounce her name because I knew she's in the room, and I said, tell me how to pronounce your name because I will butcher it, and I managed to butcher it. So she provided a very nice summary of the limited research that was, the limited research on therapy, on the therapy dog's welfare during animal-assisted activity. So the review included 9 papers, and there was a large variation in terms of study designs, the number of participants and the dogs, the disabilities of the people involved, the type of activities performed. For example, was it a group activity or was it a one-on-one activity? And the researchers also used diverse welfare indicators. For example, some used salivary or fecal or hair cortisol, some used heart rate, Some people use questionnaires, interviews, behavior observations, or they put the dogs through cognitive tests. So the study's results were also varied. Some researchers reported results that are usually associated with negative welfare states. For example, they found increased cortisol levels, or they noticed stress-related behaviors. While other researchers reported no significant changes in the welfare indicators that they measured, or they actually reported changes that are usually associated with positive welfare state. So Glank discusses the challenges associated with the measures used to quantify changes in the welfare of therapy dog. And one of the points that she makes, and other researchers have also made the same point, is the difficulty of interpreting cortisol results. So while often associated with stress, cortisol is more accurately defined as an indicator of arousal, and that arousal could be positive or negative. So if you only measure cortisol, if you notice an increase, it's hard to say if it's good or bad. So in order to understand cortisol results, one may need to pair them with other indicators, such as behavior observation, questionnaires, or interviews. These indicators are not without their own challenges. Behavior research is time-consuming and costly, and questionnaires and surveys often rely on subjectivity or opinions. So one alternative may be to pair cortisol with other non-invasive physiological measures traditionally associated with welfare states. For example, in this case, this Labrador is wearing a heart rate monitor. So in our study, we evaluated the effects of an AAA session on the emotional state of therapy dogs by using multiple physiological measures. We used tympanic membrane temperature. So on the picture here, you see what the tool looks like. This is a vanity shot because actually when we measure that, we measure it on both sides at the same time, but it was not making a very nice picture. So. And then we also use heart rate and heart rate variability. So we're all familiar with heart rate. So if you are more physically active or more nervous, your heart rate will go up. If you're less physically active or calmer, your heart rate will go down. Heart rate variability, without going into a lot of details, what you have to remember with heart rate variability is that the more variability you can measure, the better it is. It's associated with a more positive emotional state. If you find less variability, it means that the person or the animal is in a less positive emotional state. And we also use salivary cortisol and salivary oxytocin. So we talked a lot during the last 2 days about salivary or cortisol. So it's a measure of arousal. We don't know the valence. Is it good, bad? We don't know. Salivary oxytocin. So an increase in oxytocin is associated with a more positive emotional state. And if you measure a decrease in oxytocin, it's an indicator of a less favorable emotional state. So in our study, we had 229 human patients. They were between the age of 18 to 76. We had 112 subjects that were randomly assigned to the control group, so volunteer-only activity, and 117 participants were assigned to the treatment group, and most of our participants were females because most people that have fibromyalgia are also females, so that was representative of the more general population. The participants were recently diagnosed and were attending the Mayo Clinic's fibromyalgia treatment program. The program consists of individual and group sessions that are taught by nurses, internists, physical therapists, occupational therapists, psychiatrists, and psychologists. The primary aims are to educate patients, improve physical and mental health functioning, provide evidence-based treatment, options and create a long-lasting treatment regimen. It's a day-and-a-half treatment program, and the treatment and control activities always occurred at the same time in the afternoon on day 1. So it's a very intense program. People that are coming to the Mayo Clinic, they are overwhelmed. And we thought that giving them a chance mid-treatment to spend 20 minutes with a dog would help them calm down and maybe better focus on the therapy, because as you see, they're meeting people, like specialist after specialist, like nonstop for a day and a half. Okay. Our volunteers, so the dog owners. We had 19 volunteers, 15 females, 4 males. They were between the age of 24 to 68. They were members of the Mayo Clinic's Caring Canine Program. And the volunteers and their dogs were certified by AAT or AAA organizations such as Pet Partners, Alliance for Therapy Dogs International, and Helping Paws. So our 19 volunteers were asked to complete a total of 10 sessions, 5 sessions by themselves and 5 sessions with their dog. So for the dog research, it's a repeated measure design. So each dog saw 5 different people. So we obviously had 19 dogs. 13 were females, 6 were males. They were spayed or neutered, and they were up to date on their vaccines, and their average age was 6.5. We had different breeds, and we had some dogs that were mixed breeds. So the interaction took place in a small observation room in a Mayo Clinic's fibromyalgia and chronic fatigue clinic. The room was empty except for chairs for the participant, the volunteers, and the study staff member. The study staff member was not allowed to interact with the participants or the therapy dogs. The volunteers were asked to conduct themselves in compliance with the Mayo Volunteer Handbook and to keep conversation to neutral topics. Volunteers could sit in a chair, stand, sit on the floor, and talk with the participant. And the dogs were free to move around during the 20-minute session. So 5 minutes before the session, the dogs were taken to a preparation room that was just adjacent to the observation room, and we fitted them with cardiac monitors. We took their tympanic temperature on both left and right side at the same time, and we took a salivary sample. We brought them to the observation room, and they were there for 20 minutes with the people with fibromyalgia. And then we monitored their heart rate and heart rate variability. After the session, we took another reading of tympanic temperature, salivary sample again, and we removed the cardiac monitors. So what did we find? So we did not find any change pre and post session in terms of cortisol and oxytocin. We saw that there was a decrease in the right ear temperature, and there was no change on the left tympanic membrane temperature. Heart rate went down post-session, and these 4 measures that you see there are indicators of heart rate variability, and none of them changed, so the heart rate variability stayed the same. So most welfare indicators remain stable pre and post session. So you might say, oh, this is so bad, you did not find anything. But actually, that's great. It means that the dogs were not more stressed at the end of the session than they were pre-session. So no significant changes, great thing here. So based on our results, it does not appear that the dogs involved in the study were negatively affected by the participation in the sessions. And there's some evidence that the dogs may have been in a better welfare state post-session. So on that table here, it's just, it recaps our result. Salivary cortisol, salivary oxytocin, left tympanic temperature, heart rate variability, no difference. So the dogs were not more stressed at the end. But we saw 2 changes. right tympanic temperature was lower post-session, and this is suggestive of an increase in calmness or a decrease in anxiety. And the lower heart rate post-session is also suggestive of a calmer state or a reduced physical activity. So it appears that the non-invasive physiological measures that we used for this study acted cohesively. For most, there was no change. For those that changed, they pointed to a more positive emotional state. And then we may conclude that the concurrent use of multiple physiological measures should be implemented in future studies to help advance this field and our understanding of how and if AAA impacts welfare of therapy dogs. So these were the people that were involved with the study. On the left side, the Nestlé Purina team. On the right side, the Mayo Clinic team. And here's a nice picture of some of the volunteers, the dogs, and the researchers involved in the study. Voila.
A few minutes for questions. One thing, it's difficult sometimes to hear the question from everyone, so maybe if you just could repeat it.
Yes, I will.
Thank you.
I only take easy questions. It's Sunday morning.
Bring the mic.
Hi.
Hello.
Hello. Bonjour. Ça va bien?
Très bien.
I'd like to know, it's a very simple question, why you chose patients with fibromyalgia and not any other condition. Is there a specific reason? Thank you.
Good question. It was suggested by the Mayo Clinic. They have an alternative medicine department over there, and they're always trying to find new ways to serve their clients, and they saw that there was a need for these people. As I mentioned, when they come to the clinic, as you know, there's no cure for fibromyalgia. The only thing we could do is to help people manage their symptoms. So they come to the Mayo Clinic, and they have all these symptoms, they're overwhelmed, and the Mayo Clinic people believe that they would benefit from essentially, they were saying, how can we help them calm down during this day and a half? And then we say, well, let's meet dogs.
How were the dogs acclimated to...
Where's the question? Oh, hi.
Hi. How were the dogs acclimated to the testing process, the swabs, the monitors, et cetera, prior to participating in the study?
It was very easy because, as you said, these dogs are already certified by national organizations. They are also certified by the Mayo visitation program, so they're pros at their job. And then what we did, we just introduced them to the swabs. They had no issue really. And the band for the heart rate variability or heart rate, it was really they were like, sure, we could do that. I mean, it was really minimal.
And that doesn't have any effect on the dogs having a higher state of well-being at the end when those things were removed?
What? Well, we did not removing those the band, yeah, but you would need, well, that's a good question, but the heart rate variability, we look at the entire 20 minutes, so we did not look at the effect of removing the band.
Okay, thank you.
Yeah.
All right, one more.
Hi. How did Purina and Mayo Clinic come to this partnership? Like, who approached who? What was the nature of the relationship at the beginning for this study?
Maybe 4 years ago, Nestlé Purina had annual events in New York called Better with Pets, and one of the speakers was a doctor from the Mayo Clinic, and he told us about the work that he was doing at the Mayo Clinic, And then we thought it was really cool, and we started talking, and after maybe 2 years, we said we need to work together. Because at Nestlé Purina, we have great expertise in animal behavior, animal welfare, and of course, the Mayo Clinic has extraordinary expertise in human health, and we at Nestlé, we believe in the concept of One Health, and we say that would be a great illustration.
Thank you.
One more.
I have a quick two-part question. First one is, how do you account for the change in the right tympanic temperature and not the left?
How do we explain that?
Yes?
I don't, well, as you can see, it actually went down on the left side, but we only had a sample of 19 dogs, so my thinking is that maybe our sample may not have been the same thing, and also, and I'm not an expert on this field, but usually it's lateralized on the right side. It's usually when you see a decrease in tympanic temperature, it's associated with a decrease in negative emotional states, and on the left side, I believe, is associated with a positive emotional state. But don't quote me on this. I'm just an ethologist. I'm not, so.
Thank you. And
Do you have an idea? I mean, I would be.
I don't. Somebody else here might have some thoughts. That's a good one. And the other one quickly is just, was there any data gathered on the impact to the participants, the people with fibromyalgia? Thank
Yes,
you.
and as I mentioned in the beginning, this will be, we're analyzing the data, and it will be published and presented at scientific conferences. So we're right now analyzing the data on the people.
Okay, thank you.
Oh, my pleasure.